Hello guys, welcome to my stream of the new episode of Project Hospital here in YouTube. So let's just jump into it. Load. Oh, apparently we didn't save. That's kind of weird. That's really weird. I really thought that we saved here. But that's okay. If we didn't save, that means that we might just lost like a few minutes, half an, at most we lost 1 hour of progress. So that's alright. We just have to pay attention more that we have to always save, otherwise we are thrown back a little bit. So now that we actually have all the different departures on, all the different departments on, actually our job became much, how can I say, much harder because at the end of the day, okay, you go to general surgery. Hold on. Let's take a look first. We have a ton of people here in general surgery. How many in, no, I mean in ER, and only one person. So you, sir, go over to general surgery. This is your problem and they're gonna treat you. Thank you. So originally when I had only a few departments, that basically I could know very well what's gonna happen, what is the diagnosis, because it won't be a diagnosis that is in a department that I don't have. But now there is no such thing. So anyway, let's just go. You can directly cure him. Okay, malaria. We already checked everything. He does have fever. We don't have to measure that. Physical, we of course did that already. Rash on neck would have been found if there is such thing. Neck palpation we did already if we didn't have any problems, so let's just treat you as well. As you can see, every single patient is under my care. However, hold on, let me just take a look at this Karen Robinson. Here you go. This one is also waiting for players, so I cannot ignore him. I mean her. Give me a quick second. Let's finish this up before we go to the next one. So what can you do? You can only do a neck palpation, which should help you what? Just a diet modification, and you already have that. Other than that, everything he already done what he could do, even including a CRP test, which by the way came out negative. So I think we already know what's going on. However, again, should we treat him here or should we send him over to what is it? It's supposed to be actually orthopedia. Now we have actually everything here that we have to treat him with, right? I believe so. So let's again take a quick look. How is orthopedia doing? Only one person. How about you guys? Two people. So it doesn't really matter. I think just I think it's quicker because you just give him some medicine. You don't even have to treat him. I think it's quicker if we just simply ask this doctor to take care of him. And we're gonna go to this doctor. Now, let's actually, you know what? Let's actually take a look if there is any other person waiting for us. Richard Jackson, that's the one. Good. Nobody waiting for us. Nobody waiting for us. Here neither. Okay. 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 Perfect. So we are on our way. Chickenpox or American trypanosamias. Okay, it would be nice if I could actually say that. Okay, again, this is the problem with the game. I'm absolutely sure that this is the case. We have chickenpox. We don't have this because we don't have an infectious disease. I mean, I already built up like just a reception, but that's not going to be enough. So What can we do? We just do a physical basically, and that's gonna help us find everything. So I'm not even doing anything more. I'm just gonna do one physical, and it's gonna be pretty sure. Actually, probably I should have sent him even over, but that's fine. Now somebody has some serious problem. Let's see who it is. Susan Barkley. You see, all the customers are mine. I mean, customers, patients. Let's see quickly what is Susan Barkley doing here. She's got fatigue, weakness, and fever, but for whatever reason, apparently she is having some dangerous things what we don't know. So it's again kind of like helping me without, you know, me asking for it. Let's hope he's going to be okay, but let's go back to Christopher Hernandez, who has a low voltage one, and it's going to be in traumatology anyway. And traumatology, I believe, is kind of empty. So go over to traumatology, my friend. Okay, before anything, you don't have anything like really serious things. He's at mid-level problem, so it's fine. And once you are there, you can do a physical. Actually, yeah, you need a physical. Wait, maybe you don't. If you do a physical, this one is not going to help you. However, this one would. So let's just do a speech listening. The physical we don't need because whatever would find is already here. And as you can see, even if he could find redness, of course it has redness, it's burn wound, right? So no need. Let's just do that, but you, my friend, go over to the traumatology. Okay, this one, almost all cardiology, two of them in internal, one emergency. So what we can do in this case, and we already did physical, speech, and temperature. We have breathing, fatigue, chest pain, and dizziness. Okay, I would say let's do, okay, for many different things, an ECG would be very helpful. So let's do an ECG. Look at that. We have to, but the problem is that if we are doing an ECG, it's almost like it could be any of them. I don't know if ECG can actually find anything more out. Or should we try to reduce, try to close down a little bit another way? Like ECG can also find some other symptoms, right? CBC and serological. Oh, this is CBC. A urine test could help us. Speech listening, we've done already, so he doesn't have that problem. Temperature we already checked. Speech listening we did, so it doesn't look like any of these. Angiography, ECG, like a lot of things would point to this one. We could do a quick CRP test. Oh, we could actually do a couple of other tests. Let's do let's actually do an abdominal palpation. That's very quick. Let's do a CRP. That's very quick, as I learned. It's actually, you don't need to go to any other department. You can do it actually in the room. Chest, we can actually do that as well. Okay, so these are a lot of things we can do quickly, and hopefully they can determine if he has any of these issues or he has to go to a totally different department, which is probably the cardiology department. Okay, so these are both orthopedia problems. So I'm sorry, you are going directly to the orthopedia, and then we see what's gonna do. He doesn't, he has some collarbone injury and everything, so we're gonna do a physical and differential once you're there. Okay, and if really necessary, we can do a CT for you, but hopefully these two are okay. Chickenpox, there you go, you see? We did a physical, and that actually helped us determine exactly what's going on, so you're treated and you should be happy. Okay, he has fever actually, so I'm gonna give him the fever medicine. And he has medium level muscle and joint pain, so I'm gonna let him rest as well. So sometimes I'm a bit overwriting what the doctors say because I want to make sure that he is really well. Okay, so he's going to the, he had some irregular heartbeat and everything, some danger before. Now he just needs to go to the lab to do what? I think he already did all of these. Now cardiology and one is internal. So how about, so what did we just find out? Hold on. I don't know which one is new. Anyway, so why don't we... We already did a urine analysis and nothing came out of it. So I really don't think that it's, what is it, lupus. It doesn't look like lupus at all. So, but actually I can do everything from here, so no worries. Let me actually do an echo. And should I do a CBC sampling? That's a full blood test. I'm not sure if we need that right now. It's 1:17. He's gonna be a bit busy there, but let's do an echo first, just one by one. We don't want to do too many and then it turns out we didn't even need that, okay? That's an abdominal palpation that we have to do. We already know that he has this part. And by the way, it's in the internal medicine. So go over to the internal medicine. Today we are sending everybody over to the reflective departments. I am not going to spend that much time with them. So that's the only thing we need to do. So she's going over to internal medicine because we still have a lot of patients we have to treat, you know. Pulmonary embolism, that sounds bad, and he has an irregular heartbeat, which is the beta blocker that we have to give him. You see, there you go. See, I'm learning. So, you got the beta blocker, but do you have anything else? Thorax percussion would fine, we would give you analgesics, um, which means that you are in pain, basically. What would the angiography help you? Blood pressure measurement, we already did that. Angiography, you would get this anticoagulants, but you already get them anyway, so I don't want to give it to you. Interview, speech listening, we did that, and I think nothing came out of it. Chest oscillation, we did that, nothing came out of it. So thorax percussion would give you pain medicine. Now that's a possibility. So let's actually do a thorax percussion. But as you can see, first we are going to give him beta blockers anyway. So he's going to feel better. Okay, Margaret. Okay, so we actually have all these kind of things. The only thing what we always do is she has a very good differential diagnosis skill. So we're going to give him physical and then a differential diagnosis normally pinpoints what the problem is. If not, we can do an X-ray or MRI. No problem, but this is the quickest way to proceed with this. Although it's mostly not going to be our problem, but who knows. All right, William Young. We did all these and nothing came out. Look at that. We still at the exact same place. So I think We probably need to do an ECG first, or some blood test. Blood test takes a long time, but you know what? Let's just do that. Let's just CBC sampling. And urine sampling can be at the same time. And the ECG is also another time. So let's just do all of these three. And he should be able to find out what's wrong with him. Okay, what do you have? Malaria, it's already definitely internal medicine. So let's see. Want to make sure that the tables haven't turned and we don't have suddenly a rush in the internal medicine. Only 2 people, and we have 3 doctors, people. So you just go over to internal medicine. You don't have any urgent problems, so let's do a physical, I guess. Excuse me. And that's going to determine pretty much everything, all right? Good, go. And somebody else already sitting here. And look at that, it's actually the same doctor, so we don't even have to move away our camera. He has diarrhea. Now, diarrhea obviously can be anything. So let's do a physical. Let's do a temperature measurement just in case, and an abdominal palpation. I think that's like some really basics, and that could help us find out what's going on. Okay, so we already know that it's either foot contusion or ankle sprain. However, we really cannot see which one. So, ankle sprain, we would see it in MRI. Foot contusion, we could actually see it just with an X-ray. We haven't sent anybody to the MRI or X-ray, which means that MRI and X-ray are pretty empty right now. So let's send an X-ray. Okay, we know everything that is wrong with you. That's perfect. No need for further looking for other diagnosis. So we just simply treat you. However, let me just see. I'm gonna definitely make sure that he gets the diet modification. And the analgesics. The rest is up to the doctor, okay? Common cold or respiratory syncytial virus. Okay. Okay, so they have the same, exact same looking things, but if we do a nasal cavity inspection, you would find that he has some nasal viral infection. We can actually do that from there. So that's what you need to do to differentiate between them, okay? Physical, well, let's check a temperature at the same time, because if he has temperature, if he has a fever, we will have to give him anti-fever medicine, regardless where he is. Chest oscillation. Let's also do that so that we can do it once. We don't have to do it twice. That's pretty much it. Let's do. I'm pretty sure that he has this, the common cold, but let's see. And she's getting some stuff and, you know, doing her thing. Christopher Hernandez came back to us, so the speech listening actually shows confusion, okay? But we already knew that it's low voltage burn, so nothing new here. And there is nothing else we can find out, and he's already in the right department, so we're just gonna treat him. There you go, and look at that, we already have $44,000. Today we already made 24,579, which is more than our daily cost, which actually went up significantly. You know, we used to operate like 12,000, 13,000. Now it's almost 22,000. But we are already in the money, so at least we are making some money today. And no more, we don't have any loans or anything, so we're fine. So anyway, you are being treated, I believe. Yes, so let's go to you. Simple fracture of clavis is already determined by Mark Johnson. Okay, good. She has a 25% differential diagnosis ability, so that's good. Now, still there is one hidden symptom, but I'm not going to do a CT because that wouldn't show anything. So I'm wondering how come that he still has an extra symptom. It sounds impossible. So let's just treat you. Now again, do we need an ice rub? Apparently we don't. Okay. Go to you, diarrhea, muscle and joint pain and headache. And you have 3 of them are infectious disease, 1 is general surgery. None of them is our problem. But again, let's take a look here. We have actually not too many people now. I cannot scroll anymore. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5. So less than 2 patients per doctor. That's actually a good number. Okay, how about here? I believe we have 2 of them here or 3, so we have obviously less. 3 doctors, 3 patients, that's a good thing. We're definitely not having too many here. Cardiology, we have 3 people. We have we have 1 person with a high hazard, but he is going to the doctor, so hopefully he's going to be fine. We already have 3 doctors and neurologists, so they should take care of. Okay, so we are not really overwhelmed at all. As you can see, we have 31 people. So 44 people already treated, 31 people are still here. That's 75. So we have 72 are sent by the insurance companies, and probably 3 of them came back from previous days. That's my best guess. Okay, so let's see what we can do with you. I'm not really sure here. We already, of course, we have less possibilities than before. Now we can actually do a CT. Let's see. Physical, we already did. So a serological test would actually show all the infectious diseases as well, right? So why don't I'm gonna do a chest very quick. I'm gonna do a serological. Yeah, let's do a serological test, okay? Serologic sampling. I know it takes more time. It has to go to the hematology lab. Hopefully we have enough time for that. But at the same time, let's do a speech listening as well. So the doctor is gonna do some speech listening, chest oscillation, and then sends the guy over. That should make sense. Here you go. We already all in the clear. We know exactly what's wrong with you. So let's just treat you. Okay, at the lab. So let's make sure that he gets what he needs. He definitely is the analgesics and recommendation. Okay? The rest, whatever you give him, I'm fine with. So you just go to the doctor and get whatever else you need to get. You're gonna get some antibiotics and stuff like that. All right. Okay, Jane Hill, I think we found out that you had excessive abdominal cramps. We already know that. Okay, with this abdominal palpation. And there is nothing else we can do, to be honest. So we're gonna just treat you as well. Let's see, rest. I'm just double checking if there is anything high. he's getting the spasmolytics and he's getting the... Oh, he's not getting the anti-reflux. He doesn't get the fever medicine. I want to give it to her. Okay, so let's go. Oh shit! Hold on. I think I just messed up. Somebody... This is Susan Berkeley, yes. Rachel Williams, sorry, I messed it up. I passed you over. You just simply get your treatment and that's it. And then we go to this person who has fever, weakness and fatigue. Now, he's at neurology department. Actually, fun part is, none of... it's possible that neurology department, but actually more likely to go to some other places. So for now, let's just treat him. We don't have a lot of people here in neurology, so it's fine. Well, 4 people, including her, so it's okay. We have 3 doctors here. So let's see what we can do to narrow it down a little bit. We could do... X-ray chest, blood pressure. Okay, I kind of have to look at what could be a big problem. He can do a CT. Oh gosh, that's a lot of different things we could do. A blood pressure is simple and quick, and I think we have to do that. Let's do a speech listening. Oh, we cannot do a speech listening here. That's weird. Neurology and cannot do speech listening? That's like... What? Can you even do neurology? Neurologic, you know. That's so weird. That's so weird. Like, he cannot do like a neurology testing in neurology department, or it just says that it doesn't need to do that. Now, an X-ray chest would probably figure out quite a few things, but let's also do a physical because we're under. So let's do a physical and blood pressure, and hopefully that sorts thing out. Okay. Okay, let me hold on. I want to double check if I missed anything because I don't want anybody hang out here and turns out we didn't pay attention at him. There should be only one person who is waiting for us here, waiting for the player. Wait a minute, we don't even have anybody waiting for the player. Are you telling me? Margaret Wright. Margaret Wright. He's going to the lab. Go to. What's going on? So nobody's actually waiting for us. That's cool. Oh, we already know that he has urinary tract infection. Okay. He doesn't have a fever. We already know that. He might has, but again, like these two are supposed to be together, like chills or feeling of coldness during high fever. But we already checked the temperature, so it's impossible, right? So pretty much, I'm just gonna send her over to general surgery and just let them treat the sickness as it is. Thank you. Excuse me, guys. I'm really sorry about that. Common cold, yeah. Maybe I have that too. Oral cavity would give us analgesics. In other words, pain medicine. Same thing with the physical. Chest we already did. Alright, so at least we know that you have common cold and nothing else. Let's do a physical, actually. That's probably quicker. And then we're gonna give you the normal treatment. No worries. Okay. What do you have? Pulmonary embolism, your irregular heartbeat is suppressed. That's good. You still have one thing that we don't know about it. However, angiography would only give you the same medicine what we're going to give you anyway. So I think we're done here. Okay, and here you go. He's not having the he already got this, so he's not gonna get be close to collapsing or something. Let's see this guy here. Here you go. So emergency, infectious, or emergency. Yeah, it's probably emergency then. I'm gonna do a temperature, a physical, just in case he has some pain. And we're definitely gonna do a nasal cavity inspection. Now, I'm thinking, should I do now a serological? Maybe I can wait a little bit. So let's do this first. And then we might need a serological testing so that make sure that it's A or B. Common cold, you have everything. Perfect. Thank you. What did you have? All right, fine. Just treat her. Okay. We are at 239. We already made 26,500. That's good. So go to this guy. He is having a little bit discomfort of swallowing, which will definitely do a neck palpation and physical examination and an oral cavity inspection. And for good measure, let's actually do a temperature test. I really would love to have a doctor like Dr. Mike or an actual doctor, whatever, if somebody could watch my video and basically tell me if I'm doing like ludicrous things or I'm actually, you know, I would actually not, I would like to know that I'm not killing all my patients if I'm a real doctor. Okay, that would be a nice thing to know. Okay, so most likely it's going to be neurology, possibly internal or emergency, but most likely not. So, all right. Let's do a physical first. That's gonna determine a lot of things. Physical and temperature. And red eye, let's actually do a ophthalmoscopy, which just means that we are looking into your eyes. And let's take it from there. Okay, here you go. We have foot contusion. We know it already. Great. We're just gonna treat you and you're gone. Okay, guys, here's the thing. Time is kind of up. So as you can see, we didn't proceed too far ahead because it's a long process. But I actually enjoy, if the whole game was just this, you know, I actually enjoy it. I don't know about you guys. I hope that there are some people who enjoy it. Maybe some people don't. I can live with that. But if you guys enjoy it, then don't forget to hit the like and subscribe button and everything and come back because as you can see, I'm doing a mixture of things. Partially, I'm treating people. Sometimes I'm planning and building. Sometimes I just run the hospital just to see what's going on. So I'm trying to do in a way that, everything has a little, okay? Now quickly, let's do this one first. He cannot do a speech listening. That's kind of annoying. Okay, we already know that he needs antivirals, okay? And it's supposed to be a neurology problem, but in order to get speech listening, he has to go to... Oh, no, he cannot talk. Oh, crap. Okay, so this guy cannot talk. I cannot check that. Oh, okay. All right, that's kind of funny. Okay, so we have to be careful because he can have some brain inflammation, he can have some other problems. So we actually have to do a few things here. Okay, let's send him first to the ECG, and let's do a CSF sample, which is it's not a comfortable thing. But also, before we do that, let's do a chest oscillation. We cannot do a speech listening, unfortunately. We could do an EEG. We could do an EEG, which we never done before. Yeah, let's do an EEG. It's also in the neuro exam. It's also the neuro exam unit. So go and do all of that and come back, please. And we're gonna actually stop right here, guys. So let's actually save things here because last time I forgot to save. Okay, let's save. Busy day. Doesn't matter. It's just to show that I actually saved this thing. And I have to say bye-bye to you guys. So thank you so much for coming. Don't forget to subscribe, like, and all of the things. If you are on Twitch, also follow me on Twitch. And we're going to continue next time. Thank you for coming. Bye-bye.